I am Dr. Leila, and today I'm at the KSPA at the Waterfront, and we're going to show you how we do a vampire facial. My practice is called Renascent Health. I have been a medical doctor for too many years to count, and I practice integrative medicine and aesthetic medicine. Most importantly, I offer a very holistic service, and so even my aesthetic medicine patients become my integrative medicine patients and vice versa. Integrative medicine is all about looking at the patient holistically, whether it's mind, body, spirit, or aesthetics. And of course, using the most natural type medicines that we can, and of course, wherever necessary, bringing in the chemical drugs. I try and avoid that as much as possible, but I want every patient to feel that we are giving them the most effective treatment, but also the most safe. I'm very happy to announce today that we have collaborated with the KSPA at the Waterfront to join Lauren and her team in her K Aesthetics. Renascent Health has come on board to offer some of our medical aesthetic procedures, and we'd like to present a number of these videos to show you some of the procedures that you may not have seen before and remind you of those, of course, that you already know about. Today we're going to do a video on the vampire facial, hopefully debunk some of the myths and explain to you a little bit more about the science behind it. So the concept of the vampire facial is that we draw your own blood using all of the goodness that is required for your skin from your blood, so that we don't have to introduce any chemicals into the skin. This is very much in line with integrative medicine, which is all about using natural medicine that is safe and effective for the body. So when we do a vampire facial, most importantly, of course, we numb your skin. You don't have to worry about pain. It really isn't a factor. We then draw your blood and spin it in a machine called a centrifuge. Once it's spun, all the very heavy blood cells drop to the bottom, and what we're left with at the top is what we call PRP, or platelet-rich plasma. This term actually is about a serum which is holding your body's own growth factors. And you would have heard these terms before. Growth factors are little chemical messengers that tell our body how to behave. If you imagine little conductors conducting an orchestra, that's what we're really talking about. So once we've extracted this platelet-rich plasma from your blood, we then apply it onto your skin and very quickly use a microneedling device or a syringe where we inject that into your skin to essentially drive those growth factors into the live skin in the dermis. This is where they will begin to do their magic and effectively treat almost any, if not every, skin condition. Some of the indications we'll talk through later, but most commonly, of course, growth factors are used for anti-aging, because when the growth factors are introduced, they then reteach the body how to behave as it did when it was younger. When we use growth factors from the body, we have to be relatively sure that we're getting the good stuff and we're leaving the bad stuff behind. And so there's quite a lot of science that goes into the vampire facial. Many of the studies are using the machine that we are currently using at Renascent Health, and of course what we will be using at KSPA, called the Arthrex machine. And the Arthrex machine itself shows a lot more efficacy as well as safety when it comes to the kind of PRP that is drawn from your blood. Nobody can ever guarantee, at this stage anyway in the science, which growth factors are drawn from your blood. And so we want to make sure that everything that we do is giving us the best yield of growth factors and platelets. Part of this technique is that using the Arthrex device, your blood is spun at a very specific frequency and in a very specific direction so as not to destroy the things we want or pull out the things we don't want. There are a few contraindications to having a vampire facial. Among these are autoimmune diseases or any disease where there is active chronic inflammation in the system. Our therapist is trained to know which of these are important and which aren't, and she will do a sort of mini consultation with you before you have your vampire facial. This is very important for anyone who has a vampire facial anywhere, that the person who is doing it is trained to understand the medicine behind it. Our first step, as promised, is of course applying the numbing cream. Many people know EMLA as a numbing cream. We don't recommend EMLA often, most importantly because it doesn't get to the level we would like as far as numbing goes. So we compound a very specific kind of numbing cream that has a blend of a few different anesthetic agents. And we leave that on for 20 to 30 minutes on the client, longer even if they want. And they have a cup of tea, relax, read a few of our pamphlets. And then after that, we then clean it off. We're now going to remove the numbing cream, which is a very simple procedure of wiping it off. And then we use an alcohol swab to basically sterilize the skin before we apply the growth factor treatment. So we've drawn Nikita's blood, we've spun it in the centrifuge, and we've pulled out the beautiful golden PRP, or platelet-rich plasma. This is what it looks like, and this is what Cleo is going to use now to dermapen into her skin. Cleo uses a fresh needle for every client, and so our dermapen head is essentially what you see here, and each of these is a new one for every client. Important to note, by the way, that when we say dermapen, what we really mean is a microneedling procedure. Most people just know the word dermapen. Dermapen, however, is a trademark for a very specific pen. The one that Cleo is using at the moment is the M pen. The M pen we've been using for years and has always given us great results. We did use other pens in the past and they haven't given us as good results, but we're very happy with our pen at the moment. So as you can see, Nikita's face isn't covered in blood, as most people expect from that Kardashian picture. We're really just using the serum, and the blood that you are seeing is the needle points that the dermapen is using. You can also see from Nikita's face that she's completely comfortable. She doesn't have the highest pain threshold in the world, she tells me, but I don't see her flinching at all, and maybe later she can tell you about her actual pain experience. The reason we have such a short downtime when we do a vampire facial is because those growth factors are actually reducing the amount of inflammation in the skin as the procedure is happening. So already while Cleo's doing the procedure, those growth factors are beginning to work in the skin. And so we don't have as bad downtime as sometimes we have with a normal microneedling procedure. Generally, the most painful parts of microneedling, or rather the only time you actually feel anything, is when the needle is going over the bony area. So as it goes over the cheekbones or over the forehead or the nose, is really the only time that you have a sensation of something happening in the skin. Other than that, it's really very, very easy and comfortable. The other part of a vampire facial is when the doctor actually injects that PRP into the skin. The reason we would do that instead of microneedling is if we're trying to target specific areas, or if we want to get a deeper, more profound result. The procedure, of course, is more expensive when it's injected into your skin. And what we like to do at Renascent Health is combine the two, because the benefit of the microneedling in itself is something we want for everybody. But then when I inject that into the skin, we also are able to target specific areas. So if you think of things like the under eye, for example, often patients who have a sunken under eye or even puffy or dark circles under their eye, we can then inject that PRP directly into that area, and again it will tell the skin how to behave. We can also do the same thing around the eye for the crow's feet or any other lines really in the face. We often have it for patients who have those little smoker's lines around the mouth, or when there's pigmentation and we want to target PRP specifically into the pigmented areas. I've also often used it for patients where we have deep acne scarring, because then we can use the needle and break the scarring down before we actually inject the PRP into that area. We must remember that PRP was used long before it was used for aesthetics. The actual platelet-rich plasma has been used in many other medical applications, and there's a lot of science to prove its benefit. At our clinic, we use it to inject into joints, put it over wound areas. We help, of course, with hair growth, which is not a procedure we're going to demonstrate for you today, but can definitely be something that is used and effectively shown to help with hair loss. We do a lot more of AQ Skin Solutions growth factor treatment for our hair loss clients, but I think we'll do another segment on that to show you another day. There are also two other very interesting indications for PRP, that's called the P shot and the O shot. And what we do there is actually inject this platelet-rich plasma into the area in the vagina or the area in the penis, and it enhances sensitivity and orgasm. Very exciting. So what Cleo is doing now is just rubbing in the last of her PRP fluid so that it can soak into those cells that are now exposed from the microneedling. That she'll leave on to dry on the client's face. Nikita won't wash her face tonight, and what she'll feel is kind of just a tightness around her skin, and she'll have almost like a shiny sheen over her face. That's literally just leaving the PRP as close to her skin as possible so she can get the benefits of it all the time. And she can, of course, wash her face tomorrow and put makeup on as usual. The redness that you're seeing now is really dependent on each client, what their level of inflammation is like, what skin type they have, and likely with what we know about Nikita, this will probably disappear within a few hours. One of the more common indications for the vampire facial is when patients complain of large pores. And Nikita has got a few large pores around her cheek. So what I'm going to do now is use the needling technique to inject directly into that area to enhance the effect of the PRP. So that is technically a wrap. I think that we've done a really good job. We're going to see some awesome results. I can't wait to hear what Nikita's experience is and how it progresses. What we would usually recommend, and what is recommended by the science, especially for Arthrex, is that a client has at least 3 treatments a month apart. And then, depending on what's going on in their skin, a repeat maybe 6 months later or even a year later. It also, of course, depends on their home care. If you're not doing anything, you're going to need more frequent treatments. At Renascent Health, we recommend that if you have a complaint, so if there's acne or there's scarring, better to come regularly. Even with acne, you can come every 2 weeks, and then space it out later. For those of us who are just keeping up appearances and wanting to not age as fast, we also recommend that you do every 3 months a treatment like this, whether it's a growth factor treatment or a vampire, and then intersperse it with peels or skin boosters or whatever else you choose to do afterwards. Speaking of those treatments, just a reminder that we are now at KSPA as well as our Pioneers practice. KSPA is at the waterfront, so very easy for those of you who are coming from the town or Atlantic Seaboard area. We will be offering medical aesthetic treatments at the spa. They, of course, offer the most beautiful, relaxing spa treatments here, and they won't stop doing that. But we'll now be able to also offer things like microneedling, vampire facials, skin booster, growth factor treatment. And of course, I will be here to be offering patients integrative medical consultations. If you ever seen any of the work I do, I practice as a medical intuitive, and so a lot of the work we do is energetic based, and as a medical doctor focus on wellness and anti-aging, but I also see all the usual GP issues, and I look forward to meeting you.